Okay, a very good morning to all the respected listeners. This is Dr. Ashima Farooq, MBBS MD, Senior Resident Department of Physiology. Today, we are going to start with a topic without any delay that is known as the body fluid compartment. Now, body fluid compartment is one of the topics from general physiology. It is the most important topic because its extension is going to the clinical practice as well. And understanding the two types of body fluid compartment is most vital for understanding various kind of pathology, be it in the blood, be it in the synovial fluid, be it a joint problem, be it a blood investigation. All these things, there are actually the clinical applications of the body fluid compartments. So we go to the first slide. It says that a most abundant substance which is present in our body is water. Okay, we all know that gel is even a most abundant substance which is present in our body is water. And about 60% of the healthy human body weight is composed of water. So you are 60% water. And water is distributed in different compartments of the body. So what are those compartments? So first we talk about total body fluid, the body fluid content. Total body fluid is 60%. It may vary between 50 to 70% of the total body weight. And the body fluids includes the water and the dissolved solute. So whatever solutes are dissolved in water plus the water, this total makes the body fluid. Now these dissolved solutes could be either electrolytes or they could be non-electrolytes. Electrolytes, mainly the cations and the anions, sodium, potassium, chloride, and bicarbonate, magnesium, calcium. These are actually the electrolytes, and the non-electrolytes includes mostly and most predominantly glucose, urea, and creatine. So the blood levels of these electrolytes as well as the non-electrolytes are assessed periodically in a clinical practice so as to assess the actually the clinical picture of the body fluid in the various compartments, that whether it is within a normal range or not. Now let's come quickly to the body fluid compartments, their definition and types. So what do you understand by a body fluid compartment? They're the spaces in the body where the body fluid is evenly distributed. Okay, and there are two types of body fluid compartment. One is the extracellular fluid compartment and another is the intracellular fluid compartment. So ECF compartment and ICF compartment. Extracellular fluid compartment which is present outside the cell, intracellular fluid compartment which is present inside the cell. So roughly I could just categorize this into extracellular fluid and intracellular fluid. Extracellular fluid consists of plasma, the watery portion of the blood and its dissolved solute, and the interstitial fluid. Interstitial fluid is the fluid that is present between the cells, and transcellular fluid. Now, what is transcellular fluid? Other fluids like cerebrospinal fluid, intraocular fluid, pleural fluid, peritoneal fluid, synovial and digestive secretions. These all are included under the transcellular fluid domain. And another thing is the intracellular fluid, that is the fluid which is present within the cell. So you can see this is a diagram which is explaining this is the cell. So the fluid present inside the cell is intracellular fluid. The fluid which is present between the cell is interstitial fluid. Okay, and this is a blood vessel. So in a blood vessel, we have RBCs and we have the intravascular fluid. Intravascular fluid is the fluid which is present inside the blood vessel. The intravascular fluid is nothing but the plasma. So interstitial fluid and this intravascular fluid or plasma together constitutes the extracellular fluid. Okay. Now within RBCs also there is a domain of intracellular fluid because RBCs are nothing but the red blood particles, they are the red blood cells. So once again, I would like to summarize that the fluid compartment is divisible into extracellular fluid compartment and intracellular fluid compartment. Extracellular fluid compartment is again divisible into plasma, interstitial fluid, and transcellular fluid. Endocellular fluid compartment is of course the fluid which is present inside the cell. Now let's come to the proportion of these body water. So total body water is, as we have discussed before also, that it is equal to the 60% of the body weight. Now what about the extracellular fluid? Extracellular fluid is making the 20% of the body weight. Okay, that is the 1/3 of the total body water is nothing but the extracellular fluid. And again, extracellular fluid we are divided into plasma and interstitial fluid. So plasma is 25% of the ECF. Okay, 20% of the total body water is ECF, and out of that 1/3, 25% is that of plasma. So plasma is making 5% of the total body weight. Now interstitial fluid is making 75% of the ECF, so it is totally making 15% of the total body weight. As you know, 20% of the total body fluid is ECF, so 15% is that of the interstitial fluid and 5% is that of the plasma. So one third of the body weight is formed by ECF, and one third maybe 25% of that one third is made of plasma, and 75% of that one third is given by the interstitial fluid. Now, ICF, as you know, ICF consists of 40% of the total body weight. So two-thirds of the total body water is actually the interstitial, sorry, intracellular fluid. So fluid compartments, total body water, 60% of the total body water, two-thirds of the 40% of the total body water is intracellular, and one-third or 20% of the total body water is extracellular. Now, transcellular fluid is a component of extracellular fluid, as we know. So, transcellular fluid is a specialized type of ECF, example, the synovial fluid, the CSF, the ocular, the pericardial, pleural, and the peritoneal fluid. And it comprises 1 to 2 liters of the total body weight. Now the fraction refers to its relation with the preceding compartment, while the percentage refers to the relation of the total body water. Now this is again how to calculate the body fluid content. So how to calculate the total body water content of a 30 years old 70 kg man. Okay, so the weight of the person is given. As we know that 60% of the total body weight is actually the total body water. So what we are doing is we are calculating the 60% of this 70 kg, which comes out to be 42 liters. Okay, so this is how we are going to calculate the total body water of any aged person with a given amount of weight. Now, solute interview. As you know, overview is what intracellular versus extracellular. Ionic composition is very different. Okay, this is a very important concept that the ionic composition of the intracellular fluid and the extracellular fluid is very different. And this is only and only because of the selective permeability of the cell membrane. The selective permeability of the cell membrane is vital because it maintains a constant difference in the concentration of the intracellular fluid and the extracellular fluid in terms of the ionic composition. So ionic concentration is very different in both of them, and the osmotic concentration is virtually identical. So ECF is isotonic to ICF. Okay, that is very important. But the ionic composition very great. So it is like balanced. There is much more cations of one type in ECF, and the other type of cation is more predominant in this. So electrically they are neutral, isotonic to each other, but it is the ionic composition that vary considerably among ECF and ICF. So we come to the differences between ECF and ICF. In ECF, the most abundant cation is sodium. In ICF, the most abundant cation is potassium. Now, sodium is required for muscle contraction, for impulse transmission, and for the maintenance of the electrolyte balance, while potassium plays a dominant role in resting membrane potential, action potential, and maintains the intracellular volume as well as the regulation of pH. Now, most abundant anion which is present in ECF is the chloride ion. It regulates the osmotic pressure and it forms HCl in the gastric acid. Okay, so chloride ion, what are the function? It regulates the osmotic pressure, forms HCl in gastric acid. Now, anions are protein and phosphates. Right? They are proteins and phosphates which are present in intracellular fluid. Now, it is very important to know that the sodium potassium pump plays a major role in keeping high potassium concentration inside the cell and high sodium concentration outside the cell. So this maintenance of the resting membrane potential is solely attributed to the energy of the sodium potassium pumps, and they are actually deriving most of the ATP that is generated in the body is actually utilized for the function of the sodium potassium pump. Now, this is about the ionic composition of the total body fluids in milliequivalents per liter. Most importantly, one should remember that of sodium and potassium, that in ICF it is 40 milliequivalents per liter, in ECF it is 140 milliequivalents per liter, and potassium is 150 milliequivalents per liter in the ICF and 5% in the ISF. Now, let's see the factors affecting the total body water. There are many physiological factors which are affecting the total body water. They are the age, the gender of the patient, and the body fat. Now, pathological, which causes the disturbances in the fluid balance, includes vomiting, diarrhea, diseases with excessive loss of water like diabetes mellitus and excessive sweating, and blood loss. Now, others could be the climate and habits of the person. So as you know, the total body water is affected by the pathological variation like vomiting and diarrhea. We'll see how the application of ORS is actually helping in vomiting and diarrhea, and how these diseases with excessive loss of water can be replenished by the use of certain hypertonic solutions. Now, factors that affect the total body water, as I have already told you, there are the various physiological factors like age, sex of the patient, body fat, climate, and physical activity, and pathological factors like vomiting, diarrhea, diseases with excessive loss of water and blood. So this is again a ray diagram. This is showing with age how the total body water is varying. In a newborn, 80% is the total body water, and the adult male 60% of the total body weight. In an adult female, 50%, and in old age, 45%. So gradually, when the age is advancing, the total body water content is actually deteriorating. So elderly people are more prone to dehydration due to less total body water content as compared to the young age people, and infants are more prone to dehydration due to less body surface. So both the extremes of the age group, be it elderly or be it the infant, they are more prone to dehydration. And because their total body water content is very less in case of elderly people, and it is the infants in whom it is the total body surface area that is very high, so they are prone to dehydration. So infants also have a very low body fat, low bone mass, and are 73% or more water, right? Total water content declines throughout life. Healthy males are about 60% of the water, healthy females are around 50%. This difference reflects the females because this difference is reflected in females because of higher body fat content and a smaller amount of skeletal muscle. In old age, only about 45% of the total body weight is water, as I said. Now, the barrier that separates the intracellular fluid, interstitial fluid, and plasma is the plasma membrane and the body vessel wall. The plasma membrane is separating the intracellular fluid from the surrounding interstitial fluid, right? The cell which is present, the fluid which is present within the cell is interstitial fluid. The cell which is present within the cell is the ICF. The plasma membrane is separating it, and blood vessel wall is separating the interstitial fluid from the plasma. So both the counterparts of ECF are separated through the blood vessel wall. Now you know that interstitial fluid and the plasma are divided by the capillary membrane, which is permeable to salts but not to proteins, right? But the cell membrane between extracellular and intracellular fluid is not permeable to salts, but it is permeable to water, right? So you can just identify this. The plasma interstitial fluid are separated only by highly permeable capillary membrane. Their ionic composition is similar, but the protein is higher in plasma. Okay, the plasma and interstitial fluid are separated by a highly permeable capillary membrane, and their ionic composition is similar, but protein proportion is higher in plasma. And the intracellular fluid is separated from the extracellular fluid by a cell membrane that is highly permeable to water, but it is not to the most of the electrolytes of the body. This is about the speciality of these membranes, which are separating the various counterparts of the body fluid. Now, intracellular fluid, as we know that it is rich in potassium and magnesium, just remember this, is rich in proteins. Extracellular fluid is rich in sodium and chlorine, chloride ion, and plasma is rich in sodium and it is rich in proteins. Now let us understand the concept of osmolarity. Osmolarity is the unit of concentration. It describes the concentration of one solution. It measures how concentrated or diluted a solution is. It is defined as the number of osmoles of a solute per liter of the solution. The normal osmolarity of the body fluid is 300 milliosmoles per liter. So you can say the terms of concentration, osmolarity is osmoles per liter, osmolality is osmoles per kg. The molarity is moles per liter. So in biological solution, millimoles per liter, milliosmoles. So 1 mole is equal to 1 by 1 milli is 1 by 1000. So these are the units of expressing. Now what is tonicity? Reminder is what osmolarity describes the concentration of one solution, and tonicity is used to compare between the osmolarities of two or more solution, which is separated by a semi-permeable membrane. Why it is important? The difference in tonicity between the two surfacing solutions separated by semi-permeable membrane determines the movement of water between the ICF and ECF. This is a very important point. So volume, as you know, the definition which are used while describing the various body fluid compartment properties is the volume. The general clinical terms for volume abnormalities are dehydration and overhydration. And both the conditions are associated with changes in ECF volume. Now, concentration, osmolarity refers to the number of solute particles per liter of the solution, and osmolality refers to the number of solute particles per kg or kilogram of water. And tonicity is the effect of solution on the osmotic movement of water. Now, tonicity, as you know, what are isotonic, the equal tension to plasma. those fluid which are equal tension to plasma. RBCs will not gain or lose water in case of isotonic solution is provided, like the 9.9% NaCl. Now, hypotonic osmotically active solutes in lower osmolality and osmotic pressure than plasma. So what will happen? The RBC will hemolyze, and because the movement of water will take place, it will shift from RBC towards that hypotonic fluid compartment. So RBCs will hemolyze, and hypertonic, what happens? The osmotically active solutes in higher osmolality and osmotic pressure than plasma. So RBCs will prenate. Now, at steady state, osmotic pressure between the interstitial fluid and extracellular fluid is constantly nearly 300 milliosmoles per liter, and osmolarity of pure water is zero. Changes in concentration of osmotically active solute particles affect the equilibrium. Water shift happens towards the compartment of high osmolarity, and volumes of compartment change accordingly. Now, volume of extracellular fluid compartment mainly depends on the osmotically active solute particles. Osmotically active particles are expressed as osmolarity. Sorry, osmolarity is the osmotically active particles per liter, and osmolality is the osmotically active particles per kg. Now, what is osmosis? Osmosis is again the movement of water across a semi-permeable membrane from a region of low solute concentration to a region of high solute concentration. The net diffusion of water from a region of high water concentration to low water concentration. Osmotic equilibrium is maintained between ACF and ICF. Small changes in concentration in CCF can cause a huge change in the cell volume. Okay, so intracellular osmolarity under normal condition is equal to extracellular osmolarity. Now, body fluid compartment, as you know, when these body fluid will contract, this is a very important concept which I'm going to tell you right now. Contraction of the body fluid compartment takes place whenever there is introduction, whenever there will be, whenever the body fluid compartment has contracted, or you can say the person is suffering from dehydration. If you will have to supplement a fluid, you will get an isotonic fluid in case of diarrhea, vomiting, and loss of blood. Now, if it is getting expanded, you have to give normal saline. Okay. Now, hypotonic solution is required when there is a loss of sodium, there is Addison's disease, or there is adrenal insufficiency. Okay, insufficient synthesis of adrenal cortisol, and expansion will take place whenever it will take place. How the hypotonic fluid is too much water intake and antidiuretics. Now, contraction, hypertonic, too much sweat, high grade fever, and diabetes insipidus. And expansion, whenever expansion occurs, we give a hypertonic solution, there will be salt injection. So these are the various cases where isotonic fluid may work, hypotonic fluid may work, hypertonic fluid work, depending upon the condition whether the contraction of the body fluid compartment has taken place or expansion. Now, this is a very important diagram. These are known as the Darrow-Yannin diagrams. You can see that this is osmolarity versus volume. In a steady state, more or less, both are in osmotic equilibrium, and the volume is a little bit more for ICF than ECF. Now, when the osmolarity, so what is the contraction and what is the expansion? If you can see the red line is showing the contraction of the volume contraction as compared to the normal, and in the towards the right you can see isotonic volume expansion, that is the expansion of the ECF part. So body fluid compartments, as you know, osmolality versus volume, this is a steady state, and a hypertonic volume contraction and hypertonic volume expansion. This what we say is the isotonic volume contraction and isotonic volume expansion. This is what we are seeing is hypertonic volume contraction and hypertonic volume expansion. Now, what are the other thing is the hypertonic volume contraction and hypertonic volume expansion. So this is very important to identify what is actually having, whether the person is having isotonic volume contraction or isotonic volume expansion, or a hypertonic volume contraction or a hypertonic volume expansion, and a hypertonic volume contraction and a hypertonic volume expansion. So this can be explained on the basis of osmolarity concept, hypotonic, isotonic, and hypertonic. Hypotonic solution, the movement will always take from extracellular space to the cytosol. In isotonic solution, there will be no net movement of water. In hypertonic solution, the shifting of fluid will take place from cytosol to the blood. So in case of hypertonic, the RBC will shrink. In case of hypotonic, the RC will swell and ultimately hemolyze. And in case of isotonic, it will be remaining the normal. This is again nothing but isotonic, the RBC shape is not changing. In hypertonic, it is getting denated. In hypotonic, it is swelling or it will be eventually hemolyzed. This is again another pictorial representation of the movement of water. Now, water steady state, as you can see, water steady state is what the amount ingested is equal to the amount eliminated. Now, whenever there will be pathological losses like vascular bleeding, vomiting, and diarrhea, this water steady state will be disturbed, and the person may suffer from either dehydration or overhydration. So, water balance cells are largely made of water that are surrounded by a sea of water. We know that extracellular fluid composition is similar to that of a sea, right? It is having principally the sodium and chloride ion. So cells are largely made up of water and they are surrounded by sea of water. And this water is constantly being exchanged between the cells and surrounding environment, keeping a constant volume of water. Okay. Now you can see that the fluid intake is equal to fluid output and the body modifies the intake by thrust and output by the kidney excretion. Right? Now the regulation of fluid balance, water deficit or water excess. Water deficit occurs when the output is more as to input, water excess when the input is more as compared to output. So water deficit leads to hypovolemia and dehydration. Water excess would lead to hypervolemia and edema. So physiological regulation, it activates the hypothalamic thirst center. It increases the fluid intake and the hypothalamic thirst center is activated. Once it is activated, the decrease in ECF volume by 10 to 15% and increase in ECF osmolarity by 1 to 2%. And increase in ADH secretion by posterior pituitary also increases the water reabsorption by the kidney. So these are the regulatory mechanism in case of water deficit. What are the regulatory mechanism in case of overhydration or water excess? The ADH secretion is decreased, the water reabsorption is decreased, water excretion by kidney is decreased, and the thirst sensation is decreased. Right. This is how the homeostasis of the water level in the blood is maintained. This I have explained. Now, input and output, as you know, input, what the input source is, whatever we are intaking, the fluid intake, 1.25 liters. Normally, the food is 1 liter. Metabolism is 350 ml. In total, 2.6 liters of water is the input. Now, output is the gut or the feces 100 ml, urine, breathing or skin, say 900 ml, sweating 100 ml, in total 2.6 liters. Input and output, injection, and infusion, and hyperdipsia. That's how you can modify the input. And output is what? Vomiting, diarrhea, skin burns, excessive sweating, urine, diabetes, and syphilis. And average, this is how the output is increasing. So regulation of body fluid volume, the hypothalamus is achieved by two mechanisms, first mechanism and ADH mechanism. We know that regulation of fluid and electrolyte, homeostatic mechanism with respond to changes in ECF. No receptors directly monitor the fluid or electrolyte balance. They respond to changes in the plasma volume or the osmotic concentration. All the water moves passively in response to osmotic gradient. The body content of the water electrolyte rises if the intake exceeds the output. Now, primary regulatory hormones, ADH, as we know, that it stimulates the water conservation in the first center. It regulates the concentration of body fluid, aldosterone, controls the sodium absorption and potassium loss along the DCT, regulates the volume of the body fluid compartment, natriuretic peptides, and reduce the thirst and block the release of ADH and aldosterone. Now, sodium balance has to be maintained, potassium balance has to be maintained. The rate of sodium uptake across the digestive tract directly proportional to dietary intake. Sodium losses occurs through urine and perspiration. Shifts in sodium balance results in expansion or contraction of PCF. Large variations are corrected by homeostatic mechanisms. Too low ADH or ADH to aldosterone is secreted and too high ANP is secreted. For the potassium balance, potassium ion concentration in ECF are low, not as closely regulated as sodium. Potassium ion excretion increases as ECF concentration rises. Aldosterone secreted, pH rises, and potassium retention occurs when the pH falls. Now, the thirst mechanism. The thirst center in the hypothalamus contains osmoreceptors. Whenever the ECF volume decreases, then the osmolarity increases and osmoreceptors are stimulated and they activate the thirst center. The thirst is initiated and the person feels thirsty and drink water. Now, ADH mechanism, whenever the extracellular fluid volume decreases, ECF osmolarity increases, the supraoptic nucleus, which is the osmotic center in the hypothalamus, is stimulated. ADH is released, and ADH causes the retention of water by the facultative reabsorption. ECF volume increases and the osmolarity decreases. On the contrary, when the ECF volume increases, what happens that the ADH mechanism is inhibited. Now, measurement of body fluid volume. It can be done both directly by the indicator dilution method and indirectly By injecting the substance will stay in one compartment, then we calculate the volume of the fluid in which of the test substance is distributed, volume of distribution of injected material. Now, volume of the distribution will equal to the amount of substance injected minus amount excreted divided by the metabolite. So this, what are the characteristics of the marker substance or the indicator? It must be non-toxic, obviously, must mix evenly throughout the compartment being measured, must have no effect of its own on the distribution of water or other substances in the body. It must be unchanged by the body during mixing period or amount change must be known, must be easy to measure. Measurement of the total body water. As you know, using indicator dilution method, indicators use the radioactive water fraction, okay, or heavy water deuterium and antipyrine for the total body water. They mix with the total body water within hours of injection. Now, measurement of ECA volume using indicator dilation method. Indicators include radioactive sodium, radioactive chloride, thiosulfate ion, inulin, mannitol, and sucrose. The substance mixed almost completely throughout the ECA volume within 30 to 60 minutes. A measurement of plasma volume using indicator dilation method. Indicators include the Evans blue and the radioactive iodine. The substance binds with plasma protein strongly and diffuses into the interstitial fluid into the small quantity and not at all. So as you can see, the plasma volume indicators and the various compartment of which this is a summary that for plasma, the criteria is that the substance should not cross the capillaries. So we have the suitable indicators like Evans blue dye, radioionated fibrinogen, and radioionated albumin. For ECA volume, the substance should cross the capillaries but not cross the substance cell membrane. So isotonic solution of sucrose in urine, mannitol, and NaCl for the total body water, the substance should be spread evenly in ICF and ECF. So that is heavy water, tritiated H water, and aminopyrine antipyrine. So blood volume and the markers used obtained from the plasma volume and hematocrit. Total blood volume is equal to plasma volume divided by 1 minus hematocrit. For example, if the plasma volume is 4 liters and the hematocrit is 0.45, the total body volume, you have to just solve this and you have to tell me in the connect section what it is. Now take this problem. 100 milligram of sucrose is injected into a 70 kg man. The plasma sucrose level after mixing it is 0.01 milligram per liter. If the 5 milligram has been metabolized during this period, then what is the ECA volume? This question also I would like if you will answer this in the comment section. Now the compartment with no compartment specific substance determined by subtraction. How would you measure the ICA volume? It cannot be measured directly. It is calculated. So ICA volume will be equal to total body water minus ECA volume. And interstitial volume cannot be measured directly. So how this all this knowledge is related to patient care, that is most important thing. That abnormalities in electrolytes can change the osmolarity of the ECF and they can affect the cell. So in case of hypernatremia, what we call as hypernatremia, it is the increase in sodium concentration in ECF. And what is hypernatremia? It is decrease in sodium concentration in ECF. Hyperkalemia is more potassium concentration in ECF, and hypokalemia is less potassium concentration in ECF. So the most important clinical application comes in the use of intravenous fluid. You all know it is the IV fluids which is having a practical implication. IV fluid administration. Glucose and other solutions are administered for the nutritive purposes. For people who cannot take adequate amount of food, we all know it is administered slowly into the bloodstream and is prepared in isotonic solution and water is excreted in the process. Now, types of intravenous fluid, IV fluids are categorized into three types. Hypotonic, the 1.45%, isotonic, the 0.9% NaCl in water, and dextrose 5% glucose, and hypertonic, that is dextrose in 0.9% NaCl. That is a hypertonic IV fluid. Now, what happens to the different compartments by the administration of IV fluid? This diagram is very important. Effect of adding isotonic, hypertonic, and hypotonic solutions to the extracellular fluid after the osmotic equilibrium. The normal state is indicated by the solid line, and the shift from the normal is shown by the shaded area. You can see the contraction and expansion accordingly. This is a normal state towards the left, that is the A part. Now, another part, when you're adding the isotonic fluid, what is happening? The movement of the shifting of the fluid is taking place between ECF and ICF, so they equalize it. Then on adding a hypotonic solution, what happens? What is happening is the ICF is increasing, ECF is also increasing, so there is a volume expansion. And by the addition of the hypertonic solution, there is a sort of volume contraction. So what is the explanation? When isotonic NaCl is added, water volume increases and there is no change in the osmolarity because it is isotonic. When hypotonic NaCl is added, volume in ECF increases, osmolarity in ECF decreases, and the volume in ICF increases and osmolarity in the ECF decreases. And when the hypertonic NaCl is added, osmolarity in ECF will increase, volume in ECF will increase, and the osmolarity in ICF will increase and volume in ICF will decrease. So this was all about today's session about the body fluid compartment and the clinical application and the administration of the IV fluid. Thank you so much for listening.